The Alternative Dig Talk. Real issues, real talk.
Hey Teddy, have you noticed how little attention science and health issues get in the media?
Totally, Edgar, yet science information is very important.
Yeah, for sure. That's why the Health Journalists Network is here.
How can they help?
They are a group of journalists dedicated to advancing public understanding of healthcare issues through impactful reporting on health and science.
Oh, really?
Yes, they meet up every month with scientists and researchers, policymakers, and activists at the science media cafes. They then relay what they discuss to the public.
Does that benefit us?
Oh yes, very much so. This helps with health and science literacy for a healthy Ugandan society.
Okay. I love getting informed about science and health issues. Health information makes all the difference between life and death. I'll look them up and engage them.
That's great. They are based all over the country.
Oh, okay. That's interesting, and they should be making real impact.
They are empowering health communities through journalism. Journalists can save lives just like doctors.
The Alternative Dig Talk. Real issues, real talk.
Good afternoon, all our viewers. We are back at Health Hub. My name is Esther Nakkazi. I'm a freelance science journalist. I'm also the team leader at the Health Journalists Network that brings together professional journalists in this country. So this week we are talking about skin cancer in mostly children and people who are born with albinism. We know that these people in some countries have been discriminated upon. They face a lot of stigma, and most importantly, when they go out to the sun, because they don't have melanin in their skin, they get skin problems. And they also cannot move freely outside without sunglasses. Some families keep them in their houses. They don't expose them to people because of many things. We know that they've been sacrificed by communities that think that when you do that, you get rich. But this is not true, and we all know that.
Public and everywhere that these people need redress and they need to be part of the development programs. So we have educated them and we have created awareness around their vulnerability. One way that we have really achieved is that we partnered with them to petition Parliament have subsidy taxation on the sunscreens, which we together achieved. And we had massive support from the Speaker of Parliament then, and this one, we can clap for it. It was a very big achievement.
Today, we are going to talk about how they are attacked, how they are discriminated against, and the stigma they face, but most importantly, that they get skin cancer. Last year, 10 albino people from his community died of skin cancer, which is really, really sad, because we know that this can be prevented and this can be worked on. We know that Parliament has passed some good laws which are still not enough. We know that the sunscreen that comes in for people with albinism does not carry any taxes, and the glasses that they wear also doesn't carry taxes. But more needs to be done so that we really have these people survive and live a long life. They do not go past the age of 40, which is really sad.
We are advocating for more and also working together to amplify our voices against marginalization and discrimination against persons living with disability. Under the education notion, you find that children living with albinism have several been excluded and marginalized in schools. And one big milestone that we can aptly talk about was an incident when a girl child living with albinism was studying in a school for 6 years, not 6, it must have been 7 years or 8. And when they reached primary 7, that is the top class, they were supposed to to come into the boarding section. I think for them to start more. It was at that time that the head teacher of the school informed the parents of the girl living with albinism that she cannot be part of them to sit for her primary reading examination, and she cannot join the boarding section because she's a child with albinism.
I'm Peter Ogik, Executive Director of SNOPA, Source of the Nile Union.
We can work with different agencies in the government to make sure that we implement the National Action Plan. This project is not only for Uganda, they will be supporting other countries in Africa.
One of the people who is working hard to ensure that people with albinism in Uganda survive and live a stigma-free life is Doreen Namaweje, the Executive Director of Women and Children with Albinism in Uganda. Doreen and her organization are working very hard to ensure that people who are born with albinism survive and they live just like every other child, every other woman in this country. And she has this to say.
Expectations, I've talked about them. It's because of the mindset. Already now, our colleagues, when you go to give them the basics, what you really feel that will sustain them, they have great expectations. In case we have some sunscreen, the moment you go, they'll try school fees, maybe treatment, accommodation, all their problems, or maybe I had a misunderstanding with my husband. Those are the great expectations. And then also the mindset. These are people, even if you kind of like tell them we are going to do a project, we've fought so hard so that we change our own mindset, that we can do things and sustain them. For us, that's how we came out with our economic empowering project. It's called Mama Mzungu. By the way, I think I'll just share the link so that you can go there, because we have a Facebook page, Mama Mzungu, Natural Soaps. Then we also have a website for Mama Mzungu, www.mamamzungu.org. Then we have a Facebook page for women and children with albinism. We also have a website, Instagram, Twitter, all are there. In case you want to see the activities, the rescue missions, everything is there. Now, when it comes to mindset, I've been sharing about it and the great expectations. People, the projects, when it comes to economic empowerment, the projects don't normally stand. Because these people, they are not used, ourselves, we are not used to working that we make our own money. It has been a tug of war, trying to see that you have to balance between cost of production and profit.
Petra Babidye Isabidye, the Principal Education Officer, also spoke about the fact that Parliament has done some good job of ensuring that taxes on sunglasses and sunscreen for people with albinism is lifted. But this is not enough. We need to do more awareness, information, so that people with albinism are not discriminated and they are not killed.
Persons with albinism live a life of potential, a life of value, and they enjoy their freedoms just like any other person. We want to thank the Access Project for choosing Uganda, because I believe there are so many countries out there that have persons living with albinism. So we don't want to take this for granted, and we want to say thank you for coming to Uganda, and above all, thank you for considering equal opportunities as one of your potential partners.
We shall always be available to provide any kind of support that you would need from us, whether it's information, whether it's legal support, whether it's programming, anything that you would deserve to make this project work out for the inclusion of persons living with albinism. EOC is saying we are available at any time you would need us. I wouldn't have any better words, but I would say that we have walked the journey, short though with APASAS, but looking at a longer journey, depending on their programming and what they want to achieve in Uganda. And we want to say we shall always be available for consultation and engagement for for God and my country, on behalf of the Equal Opportunities Commission, I submit.
Liaison Masilat, the Advocacy and Communication Manager, who works with a project called APASAS, a project that is improving protection and access to care for people with albinism in sub-Saharan Africa. She talked about the fact that they are trying to improve and sensitize the public about people with albinism, and they have a project that is supposed to lessen stigmatization, improve awareness. So the project was launched in Golf Course Hotel last week. The project will be working in Uganda, Ivory Coast, Madagascar, Niger, and the Democratic Republic of Congo, and it will run for 3 years.
I'm Lison Marcia from the Fondation Pierre Fabre, and today it's the official launching ceremony for the APASAS project. It's a project led by the Fondation Pierre Fabre and co-founded by the Agence Française de Développement, so the French Agency of Development. And it's a project that aims at improving the protection, the prevention, and the access to care for people living with albinism. It is rolled out in 5 different countries in sub-Saharan Africa. So it's Uganda, that's why we are here today, Ivory Coast, where the team is based, Madagascar, Democratic Republic of Congo, and Niger. So this project is, most of the project is about building capacity for association of persons living with albinism and to help them to strengthen their association in terms of structuration, but also networking opportunities inside the country, but also with association from other countries. We will also create new awareness-raising materials to support them in their awareness-raising activities, but also to have more, to have activities during the International Awareness Albinism Day, which is on the 13th of June each year. And last but not least, we will also work with the authorities and the association on advocacy for the implementation of national action plans, which has been adopted in Uganda at the national level. Last October, with the French-speaking partners, we have organized an organizational diagnosis training. Next week, we will have the same training with our English-speaking partners. Then we will support them in conducting this organizational diagnosis within their association, and it will enable them to develop and to deploy a capacity building plan tailored to the needs of their structure. This capacity building plan will strengthen the capacities of each association by enabling them to attend training adapted to their needs and to their realities. Then we will also organize networking and experience sharing workshop to provide association to share best practices, but also work together on common issues.
Work with different agencies in the government to make sure that we implement the national action plan. This project is not only for Uganda, they will be supporting other countries in Africa.
Also aim to promote a better overall understanding of albinism and thus enable care and inclusion for persons living with albinism at all levels. We have launched a call for consultants to study the healthcare offers in terms of localization and availabilities, and the training offers in 3 medical specialties. The first one is mental health, the second is eye health, and the third is dermatology.
And the report that could be carried out will allow to identify gaps. These activities are essential for ensuring comprehensive care for vulnerable people, and these tools will support association in improving referrals for needed healthcare. So, for our third objective,
we wish you good luck. I'll see you next time. It is Esther Nakkazi, your host this week. Bye.
Hey Teddy, have you noticed how little attention science and health issues get in the media?
Totally, Edgar, yet science information is very important.
Yeah, for sure. That's why the Health Journalists Network is here.
How can they help?
They are a group of journalists dedicated to advancing public understanding of healthcare issues through impactful reporting on health and science.
Oh, really?
Yes, they meet up every month with scientists and researchers, policymakers, and activists at the science media cafes. They then relay what they discuss to the public.
Does that benefit us?
Oh yes, very much so. This helps with health and science literacy for a healthy Ugandan society.
Okay. I love getting informed about science and health issues. Health information makes all the difference between life and death. I'll look them up and engage them.
That's great. They are based all over the country.
Oh, okay. That's interesting, and they should be making real impact.
They are empowering health communities through journalism. Journalists can save lives just like doctors.
The Alternative Dig Talk. Real issues, real talk.